Certification and specialization. Advanced certifications and fellowships in reproductive medicine. Certification and specialization in reproductive medicine are crucial for healthcare providers who wish to pursue advanced training in reproductive endocrinology, infertility, and other aspects of reproductive health. These certifications and fellowships ensure that physicians have the necessary expertise and skills to treat complex reproductive issues, including infertility, hormonal imbalances, and genetic disorders affecting reproduction. Below is a detailed overview of the certification and specialization process in reproductive medicine, with a focus on advanced certifications and fellowships. 1. Certification in reproductive medicine. Certification in reproductive medicine is typically pursued after completing a general medical degree and an obstetrics and gynecology OB/GYN residency. Reproductive medicine is a highly specialized field that includes areas such as infertility treatment, assisted reproductive technologies, ART, endocrinology, and reproductive surgery. A certification process for reproductive endocrinologists. Medical school and OB/GYN residency. The journey to becoming a certified reproductive endocrinologist starts with completing a medical degree, MD or DO, followed by a residency in obstetrics and gynecology. The OB/GYN residency typically lasts 4 years and includes training in general gynecology, obstetrics, and basic reproductive health, fellowship in reproductive endocrinology and infertility, REI. After completing OB/GYN residency, physicians can apply for a fellowship in reproductive endocrinology and infertility. This specialized fellowship typically lasts 3 to 4 years and focuses on advanced treatment of infertility, ART procedures like in vitro fertilization or IVF, and management of reproductive health disorders such as endometriosis, PCOS, polycystic ovary syndrome, and male infertility. The fellowship provides in-depth clinical and research experience in managing complex fertility issues and allows fellows to become skilled in advanced ART techniques, reproductive surgery, and genetic counseling. Board certification in reproductive endocrinology. After completing the fellowship, physicians are eligible for board certification through the American Board of Obstetrics and Gynecology, ABOG. To obtain certification, the physician must pass a written and oral examination that assesses their expertise in reproductive endocrinology and infertility. The certification process ensures that reproductive endocrinologists have met the necessary standards for practicing in this highly specialized field. This certification is essential for the recognition of their expertise and allows them to independently practice and manage complex infertility cases. 2. Advanced certifications and specializations in reproductive medicine. In addition to board certification in reproductive endocrinology, there are several other certifications and advanced training opportunities that physicians can pursue to enhance their expertise in reproductive medicine. A. Subspecialty certification in reproductive medicine. Subspecialty certification by ABOG. After completing the fellowship in reproductive endocrinology and infertility, physicians can take the subspecialty certification exam offered by the American Board of Obstetrics and Gynecology, ABOG. This certification specifically focuses on the following areas: diagnosis and management of infertility, reproductive endocrinology and hormonal imbalances, ART assisted reproductive technologies, including IVF, egg sperm freezing, and genetic screening, advanced reproductive surgery, clinical aspects of male infertility. This certification is a recognition of advanced expertise in reproductive endocrinology and is essential for those wishing to practice as specialists in this field. American Society for Reproductive Medicine, ASRM certification. The American Society for Reproductive Medicine, ASRM, offers additional certifications for specialists who wish to focus on specific aspects of reproductive medicine. Although ASRM certification is not required for practice, it can enhance a physician's qualifications and demonstrate expertise in specific ART techniques, genetic counseling, or reproductive surgery. SRM certification is particularly beneficial for reproductive specialists who work in cutting-edge areas like egg freezing, embryo genetic screening, and advanced IVF techniques. B. Advanced fellowship opportunities in reproductive medicine. Fellowship in reproductive surgery. Some physicians may pursue an additional fellowship in reproductive surgery after completing a reproductive endocrinology fellowship. This advanced fellowship focuses on minimally invasive surgical techniques for treating infertility caused by endometriosis, uterine fibroids, tubal occlusion, or other structural abnormalities in the reproductive organs. Reproductive surgeons are trained in procedures such as laparoscopic surgery, hysteroscopy, and other advanced surgical techniques to improve fertility outcomes. Fellowship in reproductive immunology. Reproductive immunology is a rapidly emerging field that examines how the immune system influences fertility and pregnancy outcomes. Advanced training in reproductive immunology explores how autoimmune disorders, immune system dysfunction, or chronic inflammation can contribute to recurrent pregnancy loss, implantation failure, and other fertility issues. Fellowship programs in reproductive immunology allow physicians to specialize in the intersection of immunology and reproductive health, offering new diagnostic and treatment options for patients with immune-related fertility issues. Fellowship in male infertility. While reproductive endocrinology often focuses on female infertility, a fellowship in male infertility allows specialists to develop advanced expertise in the diagnosis and treatment of male fertility issues, such as low sperm count, poor sperm motility, and testicular dysfunction. This advanced training allows physicians to perform sperm retrieval techniques, provide genetic counseling, and assist in the use of ART techniques such as ICSI, intracytoplasmic sperm injection, to help male patients achieve successful pregnancies. Fellowship in reproductive genetics. Reproductive genetics is an emerging field that involves the genetic evaluation of embryos, genetic counseling for prospective parents, and the application of genomic technologies in ART. Fellowships in reproductive genetics provide advanced training in the use of genetic screening techniques such as pre-implantation genetic testing, PGT, and chromosomal microarray analysis, CMA. Reproductive genetics specialists work closely with fertility centers to assess the genetic health of embryos, screen for inherited disorders, and provide counseling for families at risk of genetic diseases. 3. Continuing education and recertification. After certification, reproductive endocrinologists and specialists are required to engage in continuing education to maintain their certification and stay current with evolving practices in reproductive medicine. A. Maintenance of certification MOC by ABOG. Reproductive endocrinologists must participate in the maintenance of certification MOCs program by ABOG. The MOC program requires physicians to continue their education through continuing medical education CME credits, which are typically obtained by attending conferences, seminars, and completing online courses related to reproductive medicine. Physicians must also complete periodic examinations to test their knowledge and ensure that they are staying up to date with current best practices. B. Research and contributions to the field. Many reproductive endocrinologists contribute to the field by conducting clinical or laboratory research. This research is essential for advancing the understanding of infertility, ART, and reproductive health disorders. Specialists may also contribute to the academic community by publishing research articles, participating in peer reviews, or speaking at conferences. C. Participation in professional societies. Physicians are encouraged to join professional organizations such as the American Society for Reproductive Medicine, ASRM, and the Society for Reproductive Endocrinology and Infertility, SREI, which provide opportunities for networking, continuing education, and staying updated with the latest advancements in reproductive medicine. 4. Conclusion. The pathway to advanced certification and specialization in reproductive medicine requires years of education, training, and ongoing professional development. After completing a medical degree and OBGYN residency, physicians can pursue fellowships in reproductive endocrinology and infertility, followed by certification from ABOG. Reproductive specialists may choose to further their expertise through advanced fellowships in areas such as reproductive surgery, reproductive immunology, male infertility, or reproductive genetics. Continuing education and participation in professional societies are crucial for maintaining certification and staying at the forefront of developments in the rapidly evolving field of reproductive medicine. By completing advanced certifications and specialized training, physicians ensure that they are equipped to handle complex fertility issues and provide patients with the highest standard of care in reproductive health.